Good morning. Welcome to Dementia Q&A. I'm Dr. Marc, internist and geriatrician. This week's question: is there a new category of dementia that I need to know about? The short answer is yes, there is. It's called late, L-A-T-E. It has a lot of features that are similar to Alzheimer's disease, and in fact, the two diseases can overlap quite a bit. Last week, an international consortium of dementia researchers and scientists published a summary of what we know about late, what we don't know, and where to go from here. Since then, a lot of people have had questions. Let's start with the basics. LATE is an acronym. Here's what it stands for. It's a bit of a tongue twister, so bear with me. Limbic predominant, age-related, TDP-43, encephalopathy. The name itself tells us a lot about how it is different or similar to Alzheimer's disease. The two have a lot in common. They're both slowly progressive, chronic diseases that affect memory, one's ability to care for oneself and do one's activities of daily living, and they both are the result of cells, mostly neurons, dying in the brain. In that sense, they're both dementias, and all the dementias are encephalopathies. It's thought that Alzheimer's disease and late can occur together, and when they do, the symptoms are thought to be more severe and progress more quickly. When they occur alone, it's thought that they progress slower. When I think about patients I've seen who had very similar symptoms that looked, for all intents and purposes, like Alzheimer's disease, in some cases, they develop their symptoms and they pass away within 6 or 7 years. In other cases, I know patients who have had symptoms and 10, 15, even later, they're still going strong. Is it possible that in some of those cases, there was late and Alzheimer's together, and in the others, they were isolated and we just didn't know it? It is possible. Unfortunately, today, there's no lab tests, there's no screening tests really that can help us differentiate late from Alzheimer's disease in a single patient in front of us. We're really just at the beginning of this journey, and it's going to take time for all that to be developed. Other similarities between the two diseases are they do come on later in life, but Alzheimer's symptoms tend to occur in the early to mid 70s, and symptoms of late, when it's isolated, tend to occur in the mid to late 80s and beyond. So almost a decade between when the first symptoms tend to occur. They both affect the central portions of the brain, the limbic system, but in Alzheimer's disease, most of the damage we see is in the hippocampus. In late, it seems to be just a little more diffuse. Other areas of the limbic system are affected. The limbic system is the central part of the brain that controls things like personality, behavior, emotions, and memory. Another distinction is that the proteins we think are involved in causing Alzheimer's disease, things like tau protein and beta amyloid, don't seem to be the proteins that are affecting patients with late. In that case, it's a protein called TDP-43. That's good news because we need new targets for drug development for dementia. All of the drugs we've created that target beta amyloid so far have not been successful in stopping the disease. Last week's report was important for a number of reasons. An international team of researchers came together and really planted a flag. They proclaimed that late is a distinct disease separate from Alzheimer's disease. They agreed on a name. They agreed on common definitions they would use to describe what the disease is or isn't. And they also proposed standard protocols to be used to speed up drug discovery and clinical trials, which is a good thing. I hope that the distinction between the two diseases makes a little bit of sense now that it's out there and in the news. I do recommend you talk about late with your physician if you have cognitive impairment or dementia, but understand that we're really at the beginning. Your physician may have very little information, and in reality, not a lot is known beyond what the pathology slides have told us. There's no real way to make a great distinction between the two diseases in the clinic in front of your physician. If you have a question about dementia you'd like a geriatrician to try to answer, please put it in the comments section. And if you've liked or shared or subscribed to the page, it's greatly appreciated. Thank you so much for watching, and I'll see you all next week.